Hello, my name is Richard Keefe, and I'm a general dentist from Canton, Ohio. I'd like to welcome you to this course where I'll share how my office receives new patients into the practice, sets the entire team up for success, and delivers an exceptional new patient experience. I'll share some of the guiding principles and many systems we established that help our team connect and accommodate patients with a high level and unique experience. What I'll be discussing is based on my years of trial and error as I work to implement many of Spear Education's vast resources available, ranging from Spear Online, Spear Practice Solutions, and workshops and seminars by resident and visiting faculty members. This course aims to lay out foundational principles and then explain how we implemented them into our practice. However, keep in mind you will need to find ways to modify what's presented here to fit your unique practice situation. Now, I know I mentioned Canton, Ohio, but I want to paint a clearer picture. My practice is in the Perry Township suburb on the borders of Massillon, Ohio. It's a medium-sized, unaffluent town that has been consistent in most demographical statistics since 2013 when I bought my existing practice. It was an 800 square foot apartment with 3 operatories, pretty much frozen in the year 1980. As you can see here, it's a picture of my old executive unit with Santa in it. When you see this and think, wait, he bought that and he's the one speaking about the patient experience, let's assure you that's only how the story starts. Despite our rather unimpressive facility and years of trial and error, I focused on the patient experience. And this mindset enabled us to deliver and still deliver an exceptional experience for new patients. However, as I developed my business plan and realized that the facilities were limiting us, we relocated to a new building down the street and expanded to 4 operatories in 2015. Then, in 2016, we expanded to 7 operatories in the same building. And then in 2019, I bought the rest of the building and we expanded to 12. Also, in 2020, I brought on an associate, and now we provide care to over 3,000 active patients in our community. The growth that we've seen has truly been remarkable. Since I graduated from dental school, I have been involved with Spear Education. And since 2017, I've been a client with Spear's Practice Solutions. Even though my practice has grown and there have been many changes and plenty of hurdles and challenges, my experience has provided me with a unique understanding of how to transition through multiple practice scenarios and dynamics. Now, throughout this course, you'll hear me say the word mini systems. So I want to take a minute to explain what they are and the role they play in implementing a new patient experience. My office uses the valuable concept of a mini system to address several types of patients and points along the new patient journey. I found that attempting to map out the entire new patient experience can be daunting and overwhelming, which can also be highly counterproductive for the team. Instead, I broke the new patient journey into small parts and built a process or mini system to address a specific issue.
It's a
This allowed
macchiato
for a
that
few
you
things.
mixed.
First, if a system isn't working, you can focus on optimizing just one part of the process instead of blowing up the entire system. And 2, it also helps train the team. You see, specific job roles need
Tastes like the
distinct levels of
espresso
training
bar.
for each new patient experience MIDI system. For example, a front office team member will need to be trained to execute the entire new patient phone call, but your assistants may only need to know the
Yeah.
context of that phone call to optimize their contribution to the new patient experience. So let's begin to discuss some new patient experience implementation strategies and mini systems that you could use right away to become the practice of choice in your community.